Okay, so we're going to get started, inshallah. So we are very grateful to have with us Maryam Rasouli. Maryam is a licensed marriage and family therapist. She has worked in various organizations with issues such as trauma, abuse, domestic violence, depression, anxiety, premarital and marital matters for almost 7 years. Maryam currently sees clients in private practice and works as a behavioral health care manager for Managed Health Network. Please join me in welcoming Maryam.
Alright, check this sound. Can you guys hear me? And anyone in the back? You guys are good? Okay. Alright, so I'm going to be speaking about trauma, specifically PTSD, post-traumatic stress disorder. So we're going to start with, to preface this, I'm going to be very interactive. There's been a lot of studies that have shown that interactive learning is the most effective for retaining information. So hopefully you guys will also help me out, okay? Alright, can you go to the next slide? Okay, so this is when I'm going to ask for your help. So when you hear the word trauma, what is the first word that comes to mind? And please speak up. Yeah. War. Okay.
Accident.
I'm sorry?
Accident.
Accident.
Children.
Children.
Shock.
Shot or shock? Shock, yeah. Tragedy.
Tragedy shock.
Tragedy, shock, definitely. I'm sorry? Injury. I'm sorry? Sexual assault, yes. Alright, what about PTSD? What is the first word that comes to mind when you hear the word PTSD?
Veteran.
Persisting.
Veteran?
Persisting.
Can you say that?
Persisting trauma.
Persisting trauma, so long term. Sure. Anyone? I know there's some sisters upstairs too, so if you guys can also chime in with this. Okay. Yeah.
It's probably post-trauma disorder.
Yeah, post-traumatic stress disorder.
So it's like the effects of trauma after they have a trauma. So what affects that stay with the patient?
So the effects after a trauma occurs, it stays with the person.
Yeah.
Okay. Yes.
Previous experience.
Previous experience. Yeah.
Hungry.
I'm sorry?
Hungry.
Hungry?
Angry.
Oh, sorry, angry. Yeah, for sure.
Oh,
Yeah.
can lead to being hungry.
Yes. Yeah.
Emotional disorder.
Emotional disturbance, definitely. Alright. Okay. Alright, so this is the overview of what I'm going to be talking about. So we're going to define what trauma and PTSD are, what happens to your body, we're going to go over that, and then reactions of a person that is dealing with PTSD and how that person looks like, signs, symptoms. And honestly, this is a prevention tool for you guys. So I hope the takeaway is maybe if you guys see these signs in someone, loved one, you can reach out and encourage them to seek some kind of help if you think it's necessary. Reactions of loved ones dealing with someone with PTSD. I know some of the speakers mentioned the fact, how do you tell someone, hey, you should go and talk to a professional? That's a really difficult job to do with any kind of illness, even PTSD. And then how to manage PTSD on your own if you're dealing with it. Alright, so according to the American Psychological Association, trauma is an emotional response to a terrible event. These are just some, these are not all. Natural disasters, hurricanes, earthquakes, tsunamis, war, any kind of political violence, terrorism, physical, sexual, emotional, psychological abuse. And then PTSD is the condition after dealing with the trauma. So it's not witnessing or experiencing the threatening event that happened. So did you guys understand the difference? PTSD is the condition that a person has to deal with, and it is very debilitating. Alright, so back to the audience. Who does it affect, from your knowledge, PTSD?
First.
I'm sorry?
Kids.
Kids? Definitely. Soldiers? Definitely.
Mothers. Prisoners.
Mothers? Yeah.
Prisoners.
Prisoners? I'm sorry? Old age. Yes. Yeah.
Orphans.
I'm sorry?
Orphans.
Orphans. Yeah. Can you go back to the other? Okay, out of these two pictures, who does it impact? These two people that you guys see, the young boy and the older gentleman. The gentleman more?
Because he suffers for the kid.
He suffers for the kid 2 times, double trauma. Okay. Sorry? Both. Okay. So yeah, it actually impacts both of these people on the screen. So young children also are impacted with trauma, from trauma, and then also older adults, adolescents, you name it. The next slide will tell you. It doesn't discriminate against anyone, any age. It can impact anyone in this room. It's not due to any kind of weakness, character, upbringing. Yes, there is a genetic disposition. I mean, that's for majority of the mental illnesses that have been shared and discussed here today and last night. So, the next slide. Some stats, statistics. According to the Center for Disease Control and Prevention, these are all from the United States. I wanted this to be relevant for everyone in this room. So 3.5% of the U.S. population deal with PTSD, and only 49.9% actually receive treatment. So basically, over half don't receive any treatment. And they're just left out there dealing with their triggers, dealing with the symptoms, not doing anything about it. Children, more than 2/3 of children actually report experiencing traumatic event by age 16. This is in the United States. And with a lot of studies, there's a lot of underreporting. So the numbers could be actually more than what's reported in studies. So what does a person look like? I know this is a lot, but I took this out of the DSM, which is kind of like what we use to diagnose people that come in. It's called a diagnostic DSM-5 actually. I'm looking off the name, but it's the manual that we use for diagnosing clients. So PTSD, it becomes a problem when it's over a month. Okay. Now we can all potentially have experienced a traumatic event the symptoms maybe less than a month, and we were okay after the month. You were okay. You were able to function the way you were. Everything went back to normal. For these people, things don't go back to normal, right? So the symptoms can also develop hours, as that states here, days, weeks. And I've had clients that have come in after 10 years, 20 years, 5 years of the actual event, and they actually want to work on it like today, now, versus 5-10 years ago. And I'll explain why that is later on. But before this diagnosis even occurs, in terms of mental illnesses, we rule out any kind of medical condition or any substance-induced symptoms. So one of the main questions we ask when a client comes in is, when was the last time you had your physical, right? Get your blood work in. Dr. Saidi went over major depressive disorder. MDD, or major depressive disorder, is actually linked to hypothyroidism. So you usually check that out in blood work. It presents very similar with depressive symptoms. We have hypothyroidism. So that's why we asked if there's any, medical issues that you're dealing with, and also if you're using any substances, alcohol, any kind of drug, anything that can be presenting with similar symptoms. So for PTSD, you actually have to have either directly experienced the event or actually witnessed the event, as Paul Noah actually mentioned the story about the child witnessing the other child in a car accident. So that's actually witnessing the experience. Or you're actually learning of a traumatic event, right? That was close to a friend or family member. Or any kind of extreme exposure to a traumatic event. and that doesn't apply to media, television, movies, or pictures. I mean, yes, that can be a trigger for someone with PTSD if they hear something or see something in a movie that might have resembled what they went through. So, I know there's a lot of writing, so I'm going to try to really simplify this, but basically what else happens is people's thoughts and perceptions are impacted. So your emotions, behaviors, your thoughts are all impacted when you have suffered or experienced a traumatic event. So some people hallucinate, some people dream. One really important, I guess, indicator of somebody with PTSD is nightmares. So they can have this right after the incident, they can have this days, weeks after, but that is one of the key things as when an individual has consistent nightmares, specifically in regards to the event that they've experienced. Children, adults, anyone. They have flashbacks. I know that's, you mentioned veterans. Flashbacks, they get triggered, they remember what happened, and they think they're in that same setting of when the event occurred. So they, do what they did in that event, whether they, hid or whatever the issue was with the war situation, for example. Let's see. Okay, a lot of people avoid the thoughts and feelings, and that's what I wanted to come back to is people that are dealing with trauma, our brains are so amazing that it has like this defense system, defense mechanism where it represses your memory. So you don't remember the exact event to protect yourself from all that suffering, emotions, fear, anything that negative things in relation to the trauma. So we do repress memory, and then some people dissociate too. So dissociation is when you're kind of not in the moment, in the present, for a period of time. And that's only to protect yourself from when you're triggered about the trauma. So in a trauma, your 5 senses are activated. So what you hear, what you smell, that you ate something, and for example, a boy that got raped on a bus by an older gentleman. That gentleman had a specific perfume, cologne on him. So after that incident, the next day or a week later, he goes to, a shopping mall. He smells the cologne, the same scent. That's the trigger. So he thinks body goes automatic flight, fight, or freeze mode. So basically that is another defense mechanism for us in times of stress to protect ourselves. So we either leave the situation, we freeze, because we don't know you don't just stop, you don't do anything. Or you fight, you're ready to, get yourself out of that fearful situation. So that's just an example. Let's see. Usually if people are in a negative emotional state, you have a lot of negative thinking. It's pretty important. Someone mentioned angry. Yes, you're more irritable, you're more angry. Self-destructive, for example. You kind of blame yourself. A lot of people that deal with trauma self-blame, like it's their fault. That whatever happened to them, it was their fault. It wasn't the person that hurt them. It wasn't, any situation, it's them. They put themselves in that kind of situation. Yes, even when there's natural disasters, people may even start blaming themselves because they're a bad person and they deserved this from their creator, for example. There's a lot of hypervigilance, so you always are looking behind, especially if you've gotten physically attacked or sexually abused or raped. You always have your guard up. This is what hypervigilance means. So it's really to an extreme. So these people, when they're in public settings, they're also guarded. And maybe me and you, or whoever's not impacted by trauma like this, when they're in a public setting, they're okay. But for people that have actually, went through something like this, when they're even in a public setting, their guard is always up, unconsciously or consciously. They may not even know it because it's their defense mechanism and it's worked for years. So that you usually rely on what we know. So people with trauma also rely on what's been working for them for years. Also sleep disturbance, appetite are also impacted by trauma. Go to the next slide. Children, so they're a little bit different in terms of how they present with PTSD symptoms. So for little ones, they don't like to be separated from their parents. And these are things that you wouldn't even realize, it would be different for your kid because they may do this anyway. But it might be to an extreme. They might, I don't know how to say this, but whatever they do before, they may not do it to the best of their ability. For some kids, they wet their beds. And I mean, that may be normal, right, for some kids, but after a traumatic event, it's actually very normal for a child to do that. They may have new things they're scared of that may not be related to the trauma. They may, usually with kids, you can see when they play. With others, with themselves, you see them with their toys if you actually observe what they're doing. It may be out of the norm for them. They don't talk like this. They don't tell you these kind of stories. That's how you know something is off. If they're drawing these scary, negative pictures, you need to ask yourself, okay, what's going on here with my child? They may have somatic symptoms that was addressed before. Usually we complain of the aches and pains versus describing them. So you're not specific with your details because you don't know. You may not know how to express that to someone. So it's usually, oh, my shoulder hurts, oh, my heart hurts. Even with adults they do this. So especially the Muslim community, the different cultures, I see this a lot. They can't tell me the feelings, but they can tell me where it hurts. And then we just kind of go from there, but it's still a starting point. And then they're more irritable and they're more aggressive with others. So what else happens to your body when you're dealing with PTSD? You have high blood pressure. Back to the hypervigilance, you're more aroused anywhere you go. The fight, flight, or freeze mode, it goes to an extreme because that is used to check us, right? In general, when we're dealing with stress. I don't know if you guys have noticed that by yourselves. Maybe it can be different. Some people freeze, some people leave the situation, some people fight. In any kind of stressful situation, and you know yourself better, so you know which one you actually implement when you're trying to, when you're dealing with a stressful situation. Aches and pains, extreme stress, heightened hearing, that goes back to the hypervigilance. It's just amazing, like people can hear things from far away that have been reported to me, and then back to the repressed memory, where we protect ourselves by not remembering what happened. And the brain does this, it's automatic, we repress it. Yes, we block it. So I've had clients come in 5 years later, and it's gone to their conscious, so they're ready, like now they want to work on it. Versus 5 years ago, when the brain just avoided and blocked the whole situation because it protects only you. Of feeling, of what you experienced, of everything that happens in the moment. So, in terms of treatment for post-traumatic stress disorder, there's psychotherapy. So, specifically, there's trauma psychotherapy, specifically cognitive behavioral therapy. So basically, it works with thoughts, your feelings, your behaviors. So what this framework deals with is basically if you're feeling a certain way, you'll act that way and you'll think that way. So if you're thinking very positively, if you notice you actually do something positive and then feel something positive. And then also vice versa with the negativity. If you're thinking negative, you act negative, and you feel negative. It's actually a cycle, or more of a triangle. It's all interconnected. There's exposure therapy, which a lot of veterans use. So basically what they do is they slowly desensitize the person to the events where it decreases the stress levels so they can actually be okay out in public or whenever they get triggered. So slowly they may show pictures of something relating to the trauma. They might go, I don't know, to the environment maybe similar of the trauma where it took place. Slowly, and then it's more, then they also go like, it's called in vivo, so it's real life. So they ask you to go to the certain places where it relates to that trauma, and then slowly it's a desensitization process for the person to be able to do their daily functioning, have low stress levels when they're in those kind of environments that trigger them from the trauma. EMDR, eye movement desensitization and reprocessing, it's kind of like a more newer therapy. So what happens is the therapist, they move fingers, it's about your eye movement. While they're doing this, or they tap, they do tapping, or they move the fingers, so your eyes have to move with the finger. And then, I've actually never seen this done, but I know about it. And then they make you kind of relive the experience. And they include like relaxation techniques, and then they also add pleasant or more positive thoughts to help basically decrease also your stress when you're faced with anything related to the trauma. And then if it's very severe, where it's the point where you can't function on a daily basis, you can't go to work, you can't get out of bed, you're isolating yourself. I mean, people get depressed when they're having PTSD as well. There's medications. People get on antidepressants, anti-anxiety. Quizastin is very known for PTSD. It actually helps with insomnia or also nightmares that people deal with. Am I going too fast? Are you guys okay? Is this too much? Overload? You guys have learned a lot today. So, managing PTSD. So the first thing to do is educate yourself like everyone has in this room today. And this pertains to, and it applies to all the other illnesses that you guys have, mental illnesses that you guys have heard about or learned about. Just educating yourself, because you may not know that you're actually dealing with this, so you can actually help yourself, right? The first step is just be aware, okay, these things are happening. Actually read up on it, and on actually the websites that Dr. Sadie, putting out those really good. I would read up on any kind of illness or anything you guys have questions on those websites. Exercise, free antidepressant. Who wouldn't want a free antidepressant that you don't need to take a pill for? Why not? So there's so many studies that show exercise can help in so many ways with any kind of stress related in trauma as well. Relaxation techniques, muscle relaxation, tension happens to everyone, right? Everyone does it differently, different places in the body. So relaxation is also, muscle relaxation is really good. Social interactions, support groups, volunteering. And then seeking out professional help if you need it. If you're not able to do all these on your own and you just see like, okay, I can't, like I'm not focusing at work, right? I'm getting triggered by hearing the song that's being played in the mall, right? By watching this daily on the news, right? It's like, okay, if it's that debilitating, then I need to do something different. Because what I've done so far has not worked. And this was already kind of addressed, but it's what to do as a loved one. I don't know if there's anyone in here that maybe knows someone that's dealing with PTSD or any trauma related. I do. I know a lot of people coming from a war-torn country. I know a lot of people that suffer with PTSD. So what you can do is educate yourself, like you guys are right now. You can maybe help the loved one find effective treatment, referrals. You know someone. I recommend this, maybe a therapist that you know, that's worked with someone else that you know. Listen with an open heart and mind, and be empathetic versus judgmental. Because that is huge with mental illness, especially in the Muslim community. A lot of people don't come in because they feel like I'm going to judge them because they come into my office, right? That's such a, for a first interaction with someone, like their guard is already up because they're going to think I'm judging them based off what they're dealing with, right? So also one of my goals is to hopefully make this normal. Like this is happening daily with people that you may know or may not know, and it's hidden. Because people with a lot of mental illnesses are really good at hiding and putting up a poker face. Because the people that I work with, you see them outside. You don't know, you have no idea. And then when they walk into your office, you're like, whoa, I was not expecting that, right? This is, I'm glad. It's something really interesting about this field is you don't know. When someone walks in, you have no idea what they're going to say. Oh yeah, family support is huge, but you can either go one or the other way. Either the family avoids it, or they actually are encouraging and supporting the loved one dealing with the mental illness. So I'm seeing more of the avoidance in this community, based on the clientele that I've worked with. It's really hard for a family to accept and want to seek out help for their loved one, or encourage the loved one to seek out help in the first place. But it's happening. Like what I'm seeing is the stigma from when I first started has decreased. People are actually more open in coming in, reaching out, calling people, even if it's for someone else. I don't care who that someone else is. The fact that the person's calling, it's such a big deal. It's such a huge deal. It takes so much courage for a brother, for a sister to call a professional, call a masjid. Do you guys know that this mosque has a counseling program free? Did you guys know about that? They provide free counseling services. How many mosques in the United States can say they do that? I don't know a lot. And the fact that this event's taking place is huge. Like I've spoken to a lot of professionals in different states, Muslims. They don't have these kind of events. They don't have professionals they can just come and talk to them and ask them questions outside, call them up. This is like such a blessing, at least for me. Because when I first started, I didn't know anyone, and I'm talking about Muslims in this field. Zero. And then, alhamdulillah, I've been able, it's more than a handful now, so it's growing. So as families, we have to pull it together because the recovery process, the process of dealing with someone that's going through trauma or any other mental illness, it can take a long time, right? This is interesting. 9 out of 10 family members, so 9 out of 10 family members in this statistic, they blame themselves for loved one's mental illness. So parents, if your kid's autistic, it's not your fault. That's huge. That's a huge thing that I hear is parents, your kid's autistic, and you blame yourself, you blame your parenting, or you blame your, it's a lot of parents too, a lot of family members blame themselves for their children's or loved ones, brothers, sisters, mental illness. That's not accurate. There's so many other factors that have been discussed. Psychological, biological, genetics, environmental, and so the process of getting help, I know this kind of has been discussed, but I'm going to just reiterate some things. Number 1, having the courage to pick up the phone and calling a hotline, calling a professional, calling a friend to tell them, oh, God bless you, calling a friend to tell him or her, hey, I'm depressed. Hey, I'm thinking of killing myself. You may be that one person in this loved one's life that considers you their support. And the fact that they know that, that's it. That's all they need to know. Because you may be that person on the other end picking up that phone call at 1 a.m. Hey, I'm sitting on the edge of this tower and I don't know what to do. That could be up to 10. The suicide rate, based on my personal experience, has increased in the Muslim community, by the way. A lot of young adults are committing suicide. I'm going off tangent, but this is so near and dear to me because I'm seeing so many of young adults, adolescents, teenagers doing this because they think that's the solution. But suicide is a permanent solution for temporary problems that we deal with on a daily basis. Seeking out resources in your community response, once again, has a counseling program. Utilize it. Make an appointment, and then with the professional that you're working with, goals, what you want to accomplish in counseling. You guys are going to be working as a team. Once again, interactive with everyone. Case scenario. Read this. Anyone read this for you? Any volunteers? Yes. Okay.
This is your 21-year-old son named Manik survived a car accident that totaled his vehicle 1 month ago. Manik has nightmares every day about the accident. Manik has not been able to drive for the past month without somebody in the car with him. For the first 2 weeks, he was not able to drive a car at all. He has a low appetite, not going out with friends.
Thank you. All right, audience. So what do you think is happening with your son in this case?
Denial.
I'm sorry?
Denial that he doesn't want to accept that he was an accident or want to drive a car. Fear. Denying it.
Denying, avoiding the actual trauma. Yes.
Scared.
Fear.
Huh? Scared. Scared?
Fear.
Fear. Yeah, definitely. Since he can't drive his car by himself anymore.
He lost his confidence.
He lost his confidence. He has PTSD. Thank you. Yes. What would be the next step for you as this person's loved one? What would you do? What would you tell this person?
Relax.
Tell him to relax and don't drive.
And then
So you would tell him to not drive for 2 weeks, then you would drive with him, and then
short distance.
short distances. Okay, so kind of slowly. Okay. But this could happen to anyone. This has happened to yes.
After months, we continues for more than months, sending him to a professional.
Since it's been over a month, thank you. So you actually read it, the details here. It's been a month, so this could fall under the category of being diagnosed with PTSD, and so he should seek out assistance because it's still debilitating his driving. Right? It could impact his job because he might want to work. People can't live in the car, right? What is he going to do? So yeah. Any other brother that earned the hero mentions, this could have been your son. Anyone here? What would you do at home? At least one brother.
I'm just thinking,
Seek help. But how would you do it? How would you tell your son that? How do you? Or your brother, your friend, the guy in class.
Just over time, I think time healing those are just to help the time pass. But I mean, I don't think you should rush him or force him to drive if it makes him feel uncomfortable, but maybe slowly transition.
So assisted transition. Okay. These are great ideas, great things to do. Definitely encouragement, because what if this person, even after, I don't know, 2 months, 3 months, I know people that haven't driven in a year after they got into a car accident.
I have people who
Yes.
didn't drive at all after that.
Yes, they stop.
Yeah.
Some people don't drive freeways, only streets.
And then they're scared with somebody else driving.
Yes.
You know.
That's when you need to go seek out professional help for sure. If it's been over a year and you don't drive, you can't can't drive. I think that was my last slide. These are the references I have that I used. Some of the ones that Dr. Saidi went over. These are all, good. I don't know if you guys are going to be sending these. Are they going to have access to any of this information? I put some references on the handout, so maybe, yeah. And then, I think that is it. Last slide. Okay,
How do they include the children facing war? How do we act with the children facing war disaster?
So, can you say that one more time?
I mean, how do we act with the children facing the disaster of the war?
So you as a, who are we talking about? You as a loved one, as a parent? Okay, so as a parent, your child witnessed war, experienced war, how to deal with that. Okay, can I first ask how, if anyone in this room has experienced the war and how they actually, what they tried to do that's worked? In this situation? I don't know if it's relevant to anyone in this room. But what, oh yeah, okay.
You're in survival mode even to this day. Does that make sense?
Okay,
If I would say even till this day you're still in survival mode.
As a child.
Yeah.
So the child is always in survival mode.
I would think. I mean everyone's different, obviously, but I'm saying I've seen people and I've heard from my own family members that they've been in survival mode even till this day, even though they don't have any worries here, but it's just in the back of their head, going back to PTSD.
Yeah, that's very, very, very accurate in terms of the repressed, how you repress the memory. It's still there long term. It's still in your brain. It's just that you repress it for a short period. But you get triggered. So as the sister was saying, what to do for your children that are dealing with PTSD. So first is you have to recognize that that's what they're dealing with. Are they having nightmares? Are they wetting their bed? Are they isolating themselves from everyone, children? Are they saying things or drawing things or telling you stories that are very negative, very, very dark, don't make sense? They may even say things that they want to hurt themselves, and I can actually tell you my youngest client that I worked with, 7 years old, he was depressed, went through trauma, and he was suicidal. He's only 7, right? So yes, that's how it can impact the child if you don't do something. So prevention is key for children. If you can, there are school counselors, they can see someone in school. You don't have to drive them anywhere. They take you out 30, 45 minutes, they work with you, you go back to your class once, 2 times a week. There's so many resources for that child to help them cope with their trauma. So you, as a parent, would be the encourager. You're going to support them. They need professional help. Because if a person doesn't get assistance at a young age, when they're adults, it impacts your social life, your employment, your getting married. I can tell you another situation where sisters dealing with physical abuse from parents. Let's say fathers in the situation, they have a hard time talking to brothers. They have a fear. Because of their trauma, they have a fear of getting into a relationship with a man. Because of the physical abuse, or sexual abuse, or emotional abuse that had occurred in the past. No fault to their own. It's not their fault when they get abused in general. There's no excuse for it, right? But back to the victim, even when children are born, they may even think, hey,
I mean, there is no professional help.
okay.
What should we do as parents?
So
Segregation?
yeah, that's the first step. Because how do you know your child is dealing with PTSD if you don't know the signs?
But I get the signs.
Okay. So if you know the signs and symptoms, you have to have the open communication and talking it down for kids, right, in very basic terms, where you can tell them, things that were more positive. We do a lot of things with play therapy for children, with their toys. we create positive experiences for them. So that's huge when they're playing, that's when you should be talking to them. Kind of, how should I say this? Creating a more positive environment, you're correcting it's basically a correctional experience. So you're creating more positive experiences for the child, but because of the trauma, they don't think it's possible anymore.
Is it good to talk about it with them?
Not if they don't. Usually it's not good to, or it's not beneficial to insert words, insert ideas that the child may not even know about, or they may not even understand. It's usually they will express that to you directly or indirectly. So because then that will be planted in your
Words.
No, they will express it. It's usually through play. Usually how they play or draw, or that's how you know. And that's when you should be present and try to work or assist or encourage or support the child. But for like planting things in their minds and saying things that it might not be relevant to their trauma, right? And every child is different. So I don't know, specifically in this case. But I can talk to you after if you like. That's a really good question. Because we're getting an influx of refugees in the scientists, and a lot of children that adult or experienced it. And they have PTSD. And they're already living, they're going to school, and it's impacting them. Yeah. Any other questions? I don't know, are we out of time?
No, 1 or 2 more minutes.
Oh, question? Sorry, I got
Thank you very much. Growing up, I was traumatized, and I was diagnosed paraschizophrenic, but I think I had many other mental illnesses at the same time. And I was wondering, what is it called? Which mental illness is it? Multiple personality or something, where you become so traumatized as a child that instead of being aware of your surroundings to survive the trauma, your mind collapses within yourself and you start living life, reflecting about what's going on inside and talking to yourself, instead of being aware of your surroundings. What's that called? You know what that's.
So if I got this correctly, in this situation, a traumatic incident happened at a young age. Basically, you repressed it and you dealt with it internally, right? It wasn't anything outward. And it sounds like a trauma-related situation, but I'm not sure specifically. I would talk to someone to get a professional. Okay.
I talked to a psychiatrist and they never told me what it's called, but it's kind of like, for the longest time, until recently, I started to recover from my trauma because of my therapy. It was as if I would lapse out of concentration, and instead of being aware of my surroundings, I would be as if I'm just thinking about what's internally going on with myself, and kind of like positive self-talking internally with myself. That's basically how I lived for a long time. And I just recently became more like aware of my surroundings and not so much internally focused.
So basically internally preoccupied. Okay, and I'm happy that you're seeing someone because whatever you're doing is working for you. I'm really happy to hear that honestly. In fact, thank you for actually sharing. This is not easy to do, by the way. Thank you so much, brother, for sharing. Can you see what you're seeing? Because it sounds like it's working out for you, but what you're describing is being internally preoccupied. So some people can hear voices, some people, talk to themselves. And these are, you can actually see the person outside and they're like moving and they're talking to themselves, but there's no one there visibly. Or to themselves. You don't see anyone there who's talking to themselves. So it could be with someone else or it doesn't have to be with someone else. But thank you for sharing, brother. Appreciate it.
This is the last question, inshallah, and then we'll break.
So let me just get this correct. So the sister's asking if you have OCD. I don't know if this was addressed in the previous discussions. Okay, what's OCD? Okay. Sister's asking if you have OCD, which is another mental illness called obsessive compulsive disorder, anxiety, and can you have anxiety and PTSD together at the same time? Yes. You can have, and how you deal with it? This is a very complex question, but thank you for asking. So obsessive compulsive disorder is an anxiety disorder, right? The drive, what pushes it is anxiety. You can either have obsessive thoughts just by itself, and you can be diagnosed with OCD, or you can have the thoughts and the compulsions. So, for example, maybe you guys have seen, people are seeing like videos, movies where people have to, wash their hands 20 times before they walk out of their home. They have to make sure their doors, they actually turn the doorknob maybe 50 times before they walk out. They have to, man, there's so many things. They're cleaning. Yeah. Yeah. The fear of uncleanliness, not being clean. Some people don't use public restrooms. No way. So that's what OCD is. So it is an anxiety disorder. Yeah, you can have that with post-traumatic stress because that might be your coping mechanism for your trauma. Some people use substances, some people use alcohol to deal with their trauma, right? That helps them, that's their solution, but it's temporary because it goes away and then they have to deal with this again.
But sometimes it doesn't go away.
And I meant the effects of the substances.
They don't go away.
Right, exactly. So that's what you have to actually get to the root. Using substances or anything else is just going to be a temporary effect. Like drinking alcohol is very temporary, and then once the effects go away, you go back to where you started, right? But in terms of how to deal with it, manage it, it depends on the severity of the OCD or the anxiety disorder. Some people need medications because they can't go to work, they don't leave their home. And it's a case-by-case situation. So it depends on the severity of the OCD, but it's treatable. We work on thoughts because the thoughts stick to you. They don't leave you. They're called sticky thoughts. So you guys actually may know people in here that have OCD, but you didn't know what it was. I don't know if I answered your question correctly.
Jill, we'll have more time for questions.
Sorry,
at dinner and a one-on-one after. I'm sorry, for sake of time, we have to end. Maryam, thank you so much for that interactive discussion. And inshallah, like I said, we will have opportunity to ask more questions of Maryam and the other speakers at dinner, which is going to be right after Maghrib, inshallah.